Sexual disorders and paraphilia, that's the topic, isn't it? We also call it psychosexual disorders and paraphilia because we are concerned about the psychiatric aspects of sexual disorders. So before we get into the disorders per se, you have to understand, just like sleep, the normal sexual intercourse also has stages. So what are the stages of the sexual act? 4 stages mainly. Okay, so it begins with desire, also known as libido, right? So that's when the person starts experiencing craving for having sexual contact, and then there is arousal or excitement, where the all the physiological processes kick in, autonomic activities are activated, and there is arousal, there is excitement, tachycardia, shortness of breath. All these things start happening during the arousal and excitement phase, and that is followed by the sexual act itself, intercourse, which is relieved by achieving climax, that is also called orgasm, right? And finally there is resolution, where everything comes back to normal again from the hyperexcited state, and this returning to normalcy, resolution, is different in both men and women. In women it is only resolution, whereas in men it also results in something called refractory period. Remember refractory period for muscle in physiology studies and all that. So it's a bit like that, during which going back to stage 1, that is desire or libido, arousal, all those things are not possible in men. So there is a period where the interest disappears following climax or orgasm, and it takes several hours, 2 days sometimes, for the desire to come back again in men. So in other words, what I am saying is repetitive sex act is not usually possible among men, whereas it is possible among women because the refractory period is absent after resolution. So which is why in women multiple orgasm is possible, whereas in men it is very difficult. I am not saying it's impossible, but it is difficult because the refractory period keeps getting more and more after every orgasm. Normally 2 to 3 times in a week, we say, is the usual rate at which some kind of sexual activity is carried out, and this may involve a partner or not involve a partner, such as masturbation. There are lots of myths and misconceptions associated with masturbation, that it leads to weakness, it leads to all kinds of psychological and physical problems. It is wrong, morally, religiously wrong, and all those kind of things. It is not true, none of that is true, because when the sexual tension increases, that is the desire stage of sex that we talked about, if it is too intense and there is no partner that is available to carry out the sex act, then masturbation is the only recourse. Otherwise the tension increases, and it will result in other things such as acting out or night falls, as in ejaculating in the middle of the night without the patient being aware. So that could also happen. Or if it leads to a lot of frustration and irritability, that's when they go out and act out and become opportunists. So all the sexual crimes may be related to this fact, the increase in sexual tension which is not relieved. So masturbation is actually required in certain settings. For example, institutionalized patients, or it could be prisoners who are in prison for a long time. What recourse do they have for normal sexual intercourse? They don't, right? So therefore masturbation would be required in those situations. So if somebody comes to you with some kind of misconception associated with masturbation, you have to educate them along these lines. But when it becomes a problem is when we discussed in the previous topic, anything can become an addiction. So excessive masturbation, if a person keeps doing it 3-4 times in a day, for example, then it becomes like any other addiction. So that is a problem. Okay, anything done in moderation is not to relieve the tension in this case. That should not really be too much of a problem unless the person is exposing himself while doing it, which becomes a paraphilia kind of disorder. So if the person, I always say, is this act being done in privacy, number one, and secondly, is the patient himself or herself or others are being harmed by him or her doing this act. So if the patient is doing it in privacy and nobody himself or others are being harmed by this act, then what business have you got to intervene? There is no business for you there. Only reassurance, no intervention required. And it's not a crime if it is done in privacy. Do you understand? So masturbation is not a disorder. Please remember. Excessive masturbation, just like we saw excessive sex, excessive pornography browsing, those can be a problem. But moderation, if done in privacy, not involving anybody else who is not willing to undergo such a process, that's not a problem. And no intervention is required. So coming back to these stages, they are important because each of these stages is associated with some disorder in both men and women. So for example, desire or libido. Hypoactive sexual desire is extremely rare in men. The reason is because men usually have high sex drive. It is a fact. That is the other difference between men and women. The sex drive is very high in men as opposed to women. So sexual desire and leading to sexual gratification, the necessity for that is very, very high in men compared to women. So hypoactive sexual desire, which is part of the desire stage disorder, is rare in men and more common in women, and that's called sexual interest disorder or reduced sexual interest. Reduced desire or reduced libido, that's more common among women. Then in the arousal or excitement stage, there is a very common condition for men called erectile dysfunction, wherein it is difficult to sustain penile erection for a long period of time and often not enough to consummate, that is, complete the sex act. So the firmness, rigidity and the thickness of penile enlargement is not enough to achieve intercourse or penetrative sex. Quite common in men, okay. And among women, there can be genital or genitopelvic pain disorder or penetrative pain disorder. So when the man is trying to achieve penetration, the woman's genitalia, which has vagina, pelvis or pelvic muscles, they can go into a spasm, and that can be very, very painful. Okay, so that again results in non-consummation of the sex act. Then in the orgasmic stage of sexual contact, in men there can be premature ejaculation, another very common condition in men. Rarely there can also be delayed ejaculation, but that's very rare. Much more common is premature ejaculation, wherein even a little bit of the previous stages, that is desire leading to arousal, causes so much excitement in the patient that he achieves ejaculation or climax or orgasm very, very prematurely, even before the penetrative act, and sometimes within a few seconds of penetrating, the orgasm is reached. So for example, if it is very severe premature ejaculation, within 15 seconds of penetrative act, there is ejaculation, so that is severe premature ejaculation in men. Remember that all of these things, conditions that I just mentioned, painful penetration or erectile dysfunction, premature ejaculation, they should be present for at least 75 to 100% of the time. That means if there are 100 sexual intercourse acts, at least 75 of those, there should be these problems. So then we call it a problem situation, which needs intervention. And it is also, DSM-5 recommends that you also specify whether it is lifelong. That means it has been present right from the first sexual act, usually during adolescence, or if it is acquired, which began later on due to secondary to some other condition. You should also mention whether it is generalized or situational. Generalized means regardless of the time of the day, regardless of which day it is, regardless of who the person is having the sexual intercourse with. If it keeps on happening, then it is generalized. Whereas if it is only situational, happens only during certain times of the day or the month, if it happens only with one partner, not the other partner, if the person is having multiple sexual partners, then it could be situational. It varies according to when you are doing it, where you are doing it, and with whom you are doing it. And also for all these conditions, you have to specify whether it is mild, moderate, or severe. So for all the conditions, specify whether lifelong or acquired, generalized or situational, and mild, moderate, or severe. So these are the main sexual stage related disorders. Treatment depends on the condition. For example, in vaginismus, which is nothing but painful penetrative intercourse problem in women, graded dilatation is advised. Graded dilatation of the vagina, that is. In erectile dysfunction, there is almost always some psychological component such as stress or anxiety. You have to address that. Premature ejaculation, squeeze technique is advised sometimes, wherein the sexual act is commenced and then stopped again so that the man does not reach orgasm too quickly. Couples therapy is advised because in a sexual act, two people are involved. So the couple as a whole, as a unit is treated together. In lack of libido, the partner's role becomes important so that sexual stimulation is done by the partner. If it is excessive sexual act or masturbation, you have to address it like an addiction. Perhaps also try anti-craving medications, counseling, group therapy, couples therapy, whatever it takes you have to do. So it depends on the condition. Excessive sexual preoccupation, SSRIs are also given. So we'll move on to paraphilias. There is a whole list of them over here. Philia is to like, which is nothing but the sexual act. Para is by the side of, isn't it? So, as in paraclinical, for example. So, paraphilias they are related to sex, these disorders, basically. That's what it means. And the DSM-5 criteria says all of them require at least 6 months for them to become a disorder. They should be present for 6 months. So voyeurism is what in common parlance is called peeping toms, basically. So they get sexually aroused by watching other people having sex. That's what it is. Related to voyeurism is exhibitionism, wherein it's the opposite. The person gets sexually aroused by exposing himself to others. And I'm saying himself because most of these conditions are more common among men. Okay, they get sexual high by exposing their private parts, genitals, to others. So accordingly, it could be exposure to children, that is exposing themselves in front of children. Flashers, that's what they are called in common terminology, right? Flashing. Or it could be exposure to adults, or it could be to both. So that is the classification of exhibitionism, children, adults, or both. Flashing in public, that's what it is. Then there is fetishism, which is getting sexually excited by contacting non-sexual things, such as non-sexual body parts, such as touching somebody's hands or feet and getting sexually aroused. Or it could be items of clothing, jewelry or something like that, and getting sexually aroused. So non-genital body parts or non-living objects, the people get sexually aroused by contacting them. A related condition is transvestism, wherein vest means dress. You know, vest, V-E-S-T, vest means dress. So they cross-dress basically. So they wear dresses of opposite gender, and they may or may not get sexually aroused by doing so. It's transvestic fetishism. See, because transvestism may be associated with fetishism. That is, what I mean is, if they wear the opposite gender clothes, they get sexually aroused. So then it becomes transvestic fetishism. Usually if they just wear the opposite gender, they are not really sexually aroused, they are just satisfied. They are satisfying some kind of urge to do so. So then it is simply known as transvestism. If it is also associated with sexual arousal, wearing the opposite gender clothes, then it is transvestic fetishism. There can also be what is known as transvestic autogynephilia. Autogynephilia. Gyne means woman. So the man, when he cross dresses, identifies himself to be like a woman and gets sexually aroused by the thought that he has somehow changed into a woman by wearing the woman's dress. Autogynephilia. So now let's talk about that masochism and sadism. Masochism is where the person gets sexually aroused by getting somebody to inflict pain, either physical or psychological pain, on himself or herself. So they allow suffering, they get aroused by suffering. And one variety of masochism is if it is associated with asphyxiophilia, also known as autoerotic asphyxiation, wherein they actually try to strangulate themselves with a cord or a belt or something, so that they induce hypoxia in the brain, and that is somehow supposed to be very sexually arousing for them. They get high on asphyxiating themselves. So that is what it is. So if masochism is associated with that, it's called masochism with asphyxiophilia. Then the opposite of masochism is sadism, wherein the person gets sexually aroused by inflicting physical or psychological pain or torture on another person. Usually masochistic people are women and sadistic people are men, although it could be the other way around also. And the two can be combined and coexist, and that is known as sadomasochism. One major condition for psychiatry is pedophilia, also called child sexual abuse. It's part of the child abuse which we keep discussing, right? Child sexual abuse, child physical abuse, child emotional abuse, and child neglect. So we are specifically talking about child sexual abuse, also called pedophilia. Remember, it is one of those conditions which is both a mental disorder as well as a crime in all countries, as opposed to something like homosexuality, which I am not including at all in this discussion because it is neither a disorder nor a crime. It is definitely not a disorder worldwide. Both ICD-10 and DSM-5 do not include homosexuality. But whether it is a crime or not depends on where you are living. I think in Malaysia it is a crime. In India, recently, about 1 or 2 years ago, it has been decriminalized by the Supreme Court of India. There was a legal battle going on for several years, which was launched by some non-governmental organizations. Finally, it was decided that it is not a crime, so it is decriminalized in India. Obviously, in US and UK, it is not a crime anyway since a long time. Yes, what were you asking? I think it's not a crime. It is an alternative sexuality, that is what it is. It's like somebody being left-handed instead of right-handed. It's somebody having grey iris color in their eyes rather than black or brown. It is like that. There have been claims made by many so-called therapists who say we can cure homosexuality, both in India and abroad. None of those therapies have ever worked. In fact, they are more torture than therapies. People who are homosexual have been subjected to all sorts of false treatments. Nothing has worked. And again, I apply those two criteria. One, whether the person is doing it in his or her privacy, number one. Secondly, whether there is harm to self or others. If your answer to these questions is no, you have no business to intervene. So I keep it very simple, you understand. But it's a complex issue. There are religious connotations to it, and there are social and cultural connotations to it. Therefore, in certain communities and countries, it is still not legal. It's still considered to be a crime. So that is about homosexuality. I wouldn't have talked at all, but I just wanted to drive home the point that it is not a disorder. Therefore, we are not including that under this topic. Do you understand? So, coming back to pedophilia, which is both a crime as well as a disorder, the implications of pedophilia for the victim are huge. As I told you earlier, it can lead to later mental health problems such as anxiety, depression, anything. Fortunately, victims themselves becoming later abusers is very rare. Usually it goes in the other way, that is, victims go on to help other victims and maybe even start non-governmental organizations which help abuse victims. That's the usual scenario, thankfully. But coming to the perpetrator, please remember that in many cases, probably the majority of child abuse cases, the perpetrator is already known to the family, known to the child, such as a relative, an uncle, family friend, anybody. Usually men, more common among men, although there have been very famous female sexual abusers also. So you have to specify whether the child abuser, that is the perpetrator or the one with pedophilia, shows exclusive preference only for children, number one, or it is non-exclusive. That means he indulges in sexual activity with both adults and children. Or if it is only child preference, that's one. And secondly, whether the preference is only for female children or only for male children or for both. There is no preference gender wise. You have to specify that also. And whether the pedophilia is limited to acts of incest. Incest means indulging in sexual activity with somebody closely related, second degree relatives and all those kind of things, such as nephew, niece, subjecting them to sexual acts. Or if it goes outside, even outside, he goes randomly picking children on the streets or something like that. So we have to specify all these things because any of these things can happen. The other important criteria for a pedophile is he or she should be more than 16 years of age, which is in the Western countries considered to be the age when sexual consent can be given, more than 16 years of age, and there should be at least 5 years age gap or difference between the victim and the perpetrator. 16 years boy, teenager boy, indulging in sex act with 11 or under 11-year-old boy or girl. So that would be pedophilia. Two adolescents, remember, they can sexually experiment with each other, having sex with each other, not considered to be pedophilia. There should be at least 5 years age difference. It is a chronic, enduring mental illness which persists for life. It can become part of the person's personality. It is very difficult to control the urges when they come along. And the other characteristic is that They are opportunists. That means they are always looking out for opportunities where they can carry out the act, such as they go and enroll themselves in schools, for example, so that they can be in an environment where there are children. Easy opportunity. Or they wait for if it is a known person, they wait for the family to go out and make sure that the child stays with them. Or they can go scouting for abandoned children, beggars' children, construction workers' children, frequently abused in India. So they can be quite opportunistic. And if it happens to be a close family member, it is the perpetrator's word against the child's word. The ignorance is so high among our people that they just assume that the child is lying and making up stories and take the side of the perpetrator. They say they are in denial. They say, no, I'm sure you are making up things. This person is not capable of doing such things. He's so good otherwise. How can he do such a thing? This happens, this plays out all too commonly. But you've got to look at the consequences of an adult exposing himself, touching a child inappropriately, or carrying out a full penetrative act on a child. The consequences can be devastating for the child, because a child does not know what is happening. It is very confusing for the child. And I told you that there are always trust issues, because it is an authority figure who abuses the child, and the child automatically trusts all these people around the child. And if somebody is breaching that trust, the child grows up with all these trust issues, not knowing whom to believe or not believe. Having further sexual contact when the child grows up also becomes a bit of a problem, because remember, PTSD can happen in a child also. There could be self-esteem issues, there could be anxiety, there could be depression, there could be drug abuse. Remember our biopsychosocial table for formulation: predisposing, precipitating, perpetuating factors. Predisposing or perpetuating child sexual abuse. It can be under psychological or social. So these factors can lead to lot of issues for the child as he or she grows up. So going back to my criteria, therefore, it may be done in private. That's fine. Is there harm to himself or others? Yeah, there is definite harm to others. In this case, the child is being harmed continuously. Therefore, it is unacceptable. Adolescents experimenting with each other sexually, that's a different matter, that's a gray area. That's just the way the society is progressing. But child abuse per se, pedophilia, it's a huge problem. It has to be managed, and that is where forensic psychiatry comes into the picture. These people ideally should be under the care of forensic psychiatrists who will be making constant assessments of the risk posed by the individual, whether he or she is fit to be living in community or should be institutionalized or not. See, the main thing to be done is to remove the child from the abusive environment as soon as possible. That is the first step to be taken. So child social services have to be contacted. They will come, they will remove the child. If necessary, place the child in foster care. Unfortunately, this is the way it proceeds in child sexual abuse. Majority of the perpetrators are not found. Even in Western countries where the services are so well developed, legal services as well as psychiatric services, they escape. There are very, very famous cases where these Western people, pedophiles, they lived in Goa, for example, in India, or they went to Thailand or some other place, so that they could escape punishment. It's easier opportunities for them. They are constantly exposed to children there. Sugar daddies, they are called. They entice children with sweets and everything, and they tell them, don't tell this to anybody, it's a little secret between you and me. I will keep giving you these sweets if you keep coming back to me. That's how it works. It's all horrible. Because remember, these pedophiles can be in any levels of the social strata, usually from higher socioeconomic strata. Could be any level. People, especially from higher socioeconomic strata, they get away. So not related, but entirely different from transvestism is transsexualism. Don't get confused between the two of them. transvestism is cross-dressing. Whereas transsexualism is where they feel the entire gender is different. They are stuck in the wrong body. A man may feel that he's got male genitalia which is dissatisfactory, he should have been born with a female genitalia. Or the woman may feel, I need to have been born with male genitalia. So this is known as gender dysphoria in DSM-5 or gender identity disorder. All of these should be present for more than 6 months. Can begin pretty early in life. Children cross-dressing, boys playing with girls' toys, dolls, wearing girls' dresses. They grow on to develop feelings of gender dysphoria, where they feel that they are stuck in the wrong body. They should become females. And it should not be explained by other medical conditions. Not endocrine conditions should not explain this problem, such as congenital adrenal hyperplasia or androgen insensitivity syndrome and all those things. It has to happen on its own without any secondary causes. So what happens to these individuals? They usually end up going for gender reassignment surgeries, right? But before that happens, they have to undergo psychiatric evaluation, and in some situations they are also given a period of up to 2 years where they have to live like a person of the opposite gender, because once the surgery is done, it is non-reversible. So they have to be absolutely sure that they want gender reassignment surgery. So they have to live like the opposite gender person. Then they undergo hormonal treatments, men receiving female hormones or women receiving male hormones, so that secondary sexual characters are developed. And finally the gender reassignment surgery is taken up. That's how it works.